Good morning, everyone. I have sad news to start this morning's press conference. A man in his 80s who was COVID positive passed away yesterday. He was a resident at the Calvary Hayden aged care facility. So on behalf of the ACT government, we send our condolences and love to his family and friends at this very difficult time. In a little over 12 hours, the ACT lockdown will end. This does not mean the end of COVID risk, though. And that's why the first step out of lockdown will be a gentle and measured step forward. Lockdown has not been easy, but it has kept our case numbers significantly lower than they would otherwise have been. Lockdown has allowed hundreds of thousands of Canberrans to get vaccinated, and it has saved tens of thousands of Canberrans from getting very sick. Since the lockdown commenced, there have been 1,359 recorded cases of the virus in the Territory. 119 people have been hospitalised. 24 have needed intensive care. And sadly, 7 people have lost their lives. Now, we've all had very different experiences during the lockdown. For the families who've experienced a loved one in hospital or intensive care, or who have lost someone to the virus, it's been scary, it's been shocking, and it's been devastating. Tomorrow is not the end of the pandemic. The virus will continue to spread in the community. Tomorrow is a step forward, though. A highly vaccinated Canberra will be a safer Canberra. And I can report that we are now at 98.8% of our eligible 12-plus population with a first dose of a vaccine. And we are at 74.7% fully vaccinated. Now, these are not just nation-leading vaccination rates. We believe they are world-leading. But the evidence clearly shows that one dose of the vaccine isn't enough to fully protect you from the worst impacts of the virus. So the statistic that matters, and the one that we will be focusing on in the coming weeks, is the percentage of our population that is fully vaccinated. That's what we're focusing on, and that's the priority over the coming weeks. We want to see our world-leading first dose vaccination rate translate into a world-leading fully vaccinated rate. Now, for those who are yet to get vaccinated, you can go today and get your first dose. The AIS mass vaccination clinic run by the ACT government has seen almost 300 walk-ins since Monday. So please, take this opportunity. You don't need an appointment. Come forward and get vaccinated. And for those who are yet to make that decision, a rainy day is as good a day as any to reach out for advice in making that decision to get vaccinated. It's okay to have questions about the vaccines, and we are very aware that the decision to get vaccinated is a bigger decision for some than it is for others. Now, if you are part of the 98.8% of the population who have received a first dose of the vaccine, but you are yet to have your second dose, and you might be wavering on having a second dose, please take the time to reach out to a health professional to discuss the importance of completing your vaccination program. Being fully vaccinated is what matters from here. Now, from tomorrow, more businesses will start to reopen. Some people will start to go back to their workplace, and we can begin to return to the life in Canberra that we are used to, the life that makes this the most livable city in Australia. But with this increased activity and interaction between people, the risk of contracting the virus increases. And this is especially the case for the 90,000 eligible Canberrans who have only had one dose of the vaccine. And it is also important for the 70,000 children under 12 who are not yet eligible to be vaccinated. So please be careful. Keep wearing your mask, keep washing your hands, and please avoid unnecessary risks as we step out of lockdown into the next path, the next step in our recovery. If you have any symptoms, you still need to come forward for testing. This is so important. The earlier you are diagnosed, the better the treatments that are available to help you recover, and the less likely it is that you will infect others. So if we can do this, we can all do this together in exactly the same way as we've managed the lockdown and the last 18 months as a community. We can look forward to much better times in the weeks and months ahead. As this will be the last formal press conference during the lockdown, I want to take this opportunity for a shout out of my own to Dr. Karen Coleman and Dr. Vanessa Johnston, our Chief Health Officer and Deputy Chief Health Officer, who have provided advice to government, who have responded to so many different issues and challenges over the course of this lockdown and the pandemic in the last 18 months, and who have always put public health first. And I want to thank both Karen and Vanessa and their teams and everyone who has supported them for providing such outstanding advice to the ACT government, and particularly to myself and Minister Stephen Smith. So it's now with great pleasure that I invite Dr. Coleman to come forward and talk about the cases overnight, the end of the lockdown, and where we are now in our public health response. Thank you.
Good morning, everyone, and thank you very much, Chief Minister. And I guess on behalf of myself and Dr. Vanessa Johnston, that was a lovely acknowledgement, but we have enjoyed working with you, Minister Stephen Smith, and all ministers, as well as the community, on this journey. As you would have seen from the update this morning on social media and the website, we have 46 new cases today as we move into the last day of lockdown, with a total of 1,359 cases. Sadly, as the Chief has mentioned, we have lost another life, and I would also like to extend my condolences to his family and loved ones. On our last day of lockdown today, and as we begin to slowly ease our restrictions, I'd just like to reiterate a few things that we have discussed and some practices that will remain vital to our continuing pathway. We know that with more people moving around the community, we are going to see more cases. This is not unexpected. The number of daily cases, though, now becomes slightly less important, and how we react to these cases is what we need to focus on. But if you are exposed to COVID in any way, via an exposure location, as a contact, or if you develop symptoms at all, please do get tested immediately and follow the appropriate isolation and quarantine requirements. This period in the outbreak is actually new for all of us, and we don't have all the answers at the moment. I don't know how high our case numbers are going to go, but we do know that if we stick to our tried and tested processes, along with our documented COVID-safe behaviours, this will keep us in the best position possible moving forward. This is an educational process for us all, and our teams will continue to support both the community and businesses to comply as best as they can with our public health directions and adapt to any changes necessary as we progress through these stages on our pathway forward. So in regard to my shout-outs, these could go on forever. There are so many amazing people in the community who have contributed during this time. But on our last day of lockdown, it does seem fitting that I will deliver my last formal shout-out of this outbreak. So this is to everyone in the ACT that has helped us get to this position. It is to our essential workers that have continued to support the community. The families left at home while their partners and loved ones have worked sometimes 24 hours on responding, and that includes mine. To our teachers who have had to completely adapt the way that they work to continue educating our children. And to the parents and carers that have juggled homeschooling with working from home and all of those other challenges, my gosh, that lockdown brings. I know that it has been tough and it has come with anxiety, stress and loss. The lockdown has affected everybody, from our youngest who have missed birthday parties and seeing their friends every day, to our elders who have had to miss their regular family visits. It has also had a significant effect on our local organisations and businesses. And I really do acknowledge that we have a long way to go in recovering from this. We recognise this, and thank you. I am grateful for all our community who have trusted the public health advice and have been prepared to cooperate with our public health social measures and give us the opportunity to get as many people protected as possible before we move forward. It's you who have put us in this position we are in today, to lift our lockdown and take our first tentative steps forward. Please enjoy reconnecting with family and friends, but please stay safe doing so. We do still have a journey ahead of us. Thank you, and I'll hand over to Minister Stephen Smith.
Thank you very much, Karen, and I want to add my thanks to that of the Chief Minister, to Dr Coleman and Dr Johnston and their teams for the incredible support that they have provided to us. I would also like to add my condolences to the family and friends of the Canberran who lost their life over the last few days. That was reported today. As we ease COVID-19 restrictions, I also want to provide an update on the ACT health system's preparedness as we move out of lockdown and start to see more cases. That's exactly what we're expecting, but our high vaccination rate we're also expecting will help prevent increases in hospitalisations and intensive care unit requirements beyond what we are planning for. So our health system has been planning for this for many months now. We are now able to model likely hospital admissions based on current active cases and the anticipated growth in new cases. But we know that there is considerable uncertainty remaining, and so our teams are reviewing this daily to ensure that we're ready for what's happening today, tomorrow, next week and in the month ahead. Both Canberra Hospital and Calvary Public Hospital, Bruce, have dedicated wards for COVID-19 patients. We're able to scale up intensive care unit capacity if needed. We have a good stock of ventilators on hand. There are 40 negative pressure rooms across the ACT health system, and the ACT government has made significant investments in Medihood technology, which increases infection protection between patients and staff. But I want to emphasise that, as I said earlier, this is an uncertain situation. That's why Canberra Health Services has been keeping staff updated regularly on the projections that we've been doing based on our case numbers. So for any Canberra Health Services staff out there, I encourage you to continue to read the Interim Chief Health Officer's regular updates, daily updates that provide regular information about the projections and what we're expecting to see. We've also been working very closely across the region. People would be aware that Canberra Hospital is the main tertiary hospital for the region, and we take our role in supporting the region very seriously. This has been factored into our planning, including the expectation of increased cases in surrounding New South Wales. However, we're really heartened by the strong uptake of COVID-19 vaccination in our neighbouring catchment areas and expect that this is an indication that demand from New South Wales COVID-19 patients will actually be less than we had initially predicted. We remain committed to providing support for those patients who do require admission from New South Wales. But dedicated COVID-19 wards have also been set up in regional centres, including Goulburn and Bega, and our regional counterparts are also already caring for their COVID-19 patients closer to home, including through the Southern New South Wales virtual care program in line with their state guidelines. So our systems will continue to work closely together to manage hospital capacity for our entire region, to share plans and protocols, and to meet and our senior representatives meet several times a week to support each other during these challenging times. We all recognise, as we've talked about before, that our health systems come into this under pressure already. That's why state and territory health ministers have written to the Commonwealth, urging them to come to the table to talk about the support that is required. Our systems are under pressure because we have patients with extended lengths of stay who have been unable to be discharged to NDIS packages or aged care because our primary care system isn't well enough supported to provide care to those patients with complex and chronic conditions who end up unnecessarily in our hospitals. So I acknowledge that the pandemic has placed significant pressure on our entire frontline workforce. At the start of the outbreak, we quickly moved to boost our health workforce through a call out for nurses and other health professionals. And these efforts have been very successful, with more than 600 team members joining our public health system. Almost all of these new staff will stay on to assist in the months ahead as the ACT opens up and we prepare for an increase in COVID-19 presentations. Many of those working in our vaccination clinics will soon be freed up to assist with COVID-19 testing and to work in our walk-in centres, our community health centres and our hospitals. We'll also undertake additional recruitment as needed in line with hospital surge requirements in the months ahead. And we'll be boosting our graduate nurse recruitment for 2022 to help meet these challenges and our commitment to nurse-patient ratios. With increased community transmission, many areas of our health services have been affected by COVID-19 exposures. In some cases, this has led to ward lockdowns and the need to manage complex quarantine arrangements for staff, carers and patients. I'd particularly like to recognise those staff who have backfilled colleagues who are in quarantine to minimise any impact on our services, often at very short notice. And I'd like to thank all of those healthcare workers who've had to spend more time than usual away from their families due to their role in the COVID-19 response. Today is International Allied Health Professionals Day. So this is an excellent opportunity to particularly celebrate and appreciate the achievement of health professionals in Canberra and across the world. Several of Canberra's highly regarded allied health professionals have been recognised in the Allied Health Professional of the Year and Allied Health Excellence Awards today. Yesterday was also Emergency Nurses Day, which acknowledges the hard work and dedication of emergency nurses all around the world. So I'd like to acknowledge this diverse group of healthcare workers who are quietly getting on with the job of improving the lives of members of our community. They care for our community across many settings, from the front doors of our emergency department to in-reach in individuals' homes. I'd like to again finish before I hand over by thanking all of the teams across our health services for their tremendous dedication and reaffirm the government's commitment to supporting them. With that, I'll hand over to Peter from ACT Policing.
Well, thank you, Minister. Good afternoon to you all. Firstly, on behalf of ACT Policing, I would just like to express our appreciation for the commitment and energy of all Canberrans in terms of keeping us safe. We've been able to reach the time to move out of lockdown as a result of your efforts. Importantly, our message coming out of lockdown is restrictions will still exist, and so please stay safe, stay informed, and do all we can as a community to keep people out of hospital. While there will be changes this weekend with the easing of some restrictions, there are things that you still need to remain aware of, and that will continue as part of our pathway forward. A lot of people have seen ACT road policing in terms of undertaking compliance checks, and in fact we have undertaken in excess of 50,000 of those compliance checks over that period, including 620 turnarounds. But that will continue, and it will be a case, as we have a strategy of anywhere, anytime, and we'll continue to do that. So again, people need to remain mindful of what the requirements are, if they're travelling out of the ACT, what it is they can and can't do, and what it means for them in returning back to the ACT. Importantly, working with our partners across ACT government, we will continue to focus on areas of potential risk. That includes places such as schools, where there's any potential breaching of legislation, of the road rules, to keep our community safe. As we move back into a more normal type of environment, those things and those issues become our focus. ACT Policing will continue to conduct compliance checks of hotels, of businesses, of people who are undertaking home quarantine. And in fact, we've undertaken in excess of 3,200 of those compliance checks. And as I mentioned before, one of the key things that has led us to be able to move out of lockdown is how community spirited the people of Canberra and the ACT have been. That has enabled us to reach this point. I implore you to, as we move forward, to continue to wear your mask, continue to social distance, continue to be aware of what you're required to do under the health directions. The ACT Policing will be out there. They will, as much as we can, provide advice to you, but you also need to be aware of what your requirements are. And as retailers open, you need to be aware of what you can do. But importantly, those people working in stores are members of our community and are contributing to our community. So please be decent to them. Please be patient. Some of these things will be challenging as we move through the next few weeks into the next phase. But COVID, of course, is not going away, and this is something we continue to be mindful of, is just being respectful to our people. I'd just like to finish up with a bit of a shout out as well, which has been a bit of the norm, and that is to not only all our members of ACT Policing, our partners across government, including those members of the Australian Defence Force have been assisting us, but for me it's been about the families of our members and how much support they provide to our people to go to work every day and support our community. And importantly, just a thanks to the Chief Minister and all ministers for the support they've provided us through this process. I'll now hand back to the Chief Minister. Thank you.
Thank you very much, Peter. Happy to take questions. Harry.
Chief Minister, having to announce another death on the eve of the end of the lockdown, did that give you a bit of pause for thought, and have you reconciled yourself for the fact that we might see more deaths and increased case numbers?
Yes, in short, and we've done a lot as a community to get vaccinated, to support each other, but this next step, and it's an important step forward, needs to be taken carefully. And for those of us who are fully vaccinated and who have been for some time, I think it's important that we understand that there are 90,000 fellow Canberrans who are not yet fully vaccinated, mostly because they haven't had the chance to, because the vaccine supply wasn't there at the beginning, that they've booked in, they've done the right thing, and they're just waiting for their second dose. So we need to acknowledge those people and support them and protect them because it's fully vaccinated that matters, not partially. And then also the 70,000 under 12s. Now, the best thing that we can do at the moment to protect them is for all the adults around them to be fully vaccinated. And this jurisdiction has led the way on that. Could not be prouder of our response in getting vaccinated.
As we've heard, this may be the last of the formal daily press conferences. What sort of commitment will you give to providing information to the public, to facing scrutiny as we move into this fairly important stage in the change of restrictions?
Well, we'll obviously be around every day, and should anything particularly dramatic occur, then there will of course be a press conference, and probably in this room, as we step through the next stages of our pathway forward. I would envisage that there will be the odd press conference like this that would outline that next step. But what I am signalling is that it may not necessarily be at 11:45am on the dot every single day, 7 days a week, as it had been up until very recently, and then 6 days a week, and then 5. But you all know where I am. Generally know how to ask a question.
Will Canberrans be seeing you 2-3 days a week? Have you set out anything there?
Well, you'll certainly be seeing me tomorrow. I'm looking forward to a small gathering with a niece and nephew who are pretty keen for their uncle to take them for a coffee and cake date. So I'll foreshadow that one tomorrow. So you'll have an opportunity then. And then, look, we're about to go into 2 weeks of ACT budget estimates, so we'll either be around in that context and we'll be talking about those things as well as COVID matters. So I expect things will look a little bit more like they did pre-lockdown, where I get media requests pretty well every day. But whether every single thing is a big press conference that's live streamed and broadcast live is another matter, obviously.
Chief Minister, there will be many ACT businesses that aren't reopening tomorrow, either because they're not allowed to still, or because the restrictions are so tight that it's simply not worth it. We've got a world-leading vaccination rate. Do you really think this is a world-leading reopening?
Definitely, yes.
Why is that?
Because it puts public health first, because it ensures that the safest activities are recommencing and the riskiest ones wait until we have more of our population fully vaccinated.
You called it gentle and measured, but is it too cautious considering how high this rate is?
No, definitely not.
And would you say that to the business owners who still can't open their doors, who are
absolutely
going to start missing out on COVID disaster payments?
Well, COVID disaster payments are not paid to businesses, they're paid to individuals.
But to the staff members who still can't go back to work?
And that's not my decision, that's a decision the Commonwealth Government have made, but the payments do continue, and they will continue beyond today, well into November. The next step in our pathway forward, which is due in a couple of weeks, enables a significant increase in business activity, and by that stage we would anticipate that our fully vaccinated population will have gone above 80%. But it's going to take another 3 to 4 weeks for those, particularly those who have just had their first dose in the last 7 to 10 days, to get their second dose 3 to 4 weeks later, depending on whether they've had Pfizer or Moderna. But in the end, economic activity is entirely linked to the success of the public health response. Open up too early, have another outbreak, the loss of consumer confidence will be devastating. And so a fully vaccinated Canberra is a much safer Canberra for the long term. So let's not just think about the next 2 weeks. Let's think about the rest of the year, Christmas, the summer period, and then into 2022. That's got to be the focus. I know there's one of the downsides of daily press conferences, aside from the same question being asked a lot.
Oh, it's a fair question. There are many in the public who would be asking these questions too.
Okay, look, would you allow me to answer the question? Thank you. One of the downsides of that is short-termism, everything in this 24-hour cycle. We've got to think but beyond the next day and beyond the next week to what the next month, Christmas and 2022 is going to look like. And what I'm saying, and this is the best health advice, the best economic advice, is that the more vaccinated we are, the less likely there is of having to have a yo-yoing of public health restrictions, of having to go back into targeted lockdowns, and of having ongoing economic disruption. Now, I've heard a lot about people wanting certainty. Now, the most certainty you can get is in a fully vaccinated population. Now, there were sceptics at the beginning that we would not get, we wouldn't get above 80%, we wouldn't get above 90%, we wouldn't get above 95%. Well, we're closing in on 99%. We've got 90,000 people who will get their second dose in the next 3 to 4 weeks. So let's get them vaccinated, and then we all have a safer future together, a stronger economic rebound together. That's what I'm focused on.
Just while we're on that, can you provide an update on how many businesses have applied for support grants, how many have received grants, how many are still waiting for grants, and how many have been outright rejected?
Okay, so $220 million of business support has been approved to nearly 8,300 applicants. The business extension payments, so the additional amounts, have been paid to a further 5,087 of that 8,300. There are 1,125 applications that have passed through the first stage, and there are 709 needing further information. 158 have been declined, and the total number of applications received when the applications closed was 11,691. Now, most of those applications came in the last few days, and so they are going through their assessment process. So they've not been waiting 30 days, they've just come in the last couple of weeks. But the ones that were lodged at the beginning have been paid. And there's $220 million that's been paid out. So that's the single largest grants program in the history of the Australian Capital Territory.
So for those 1,025 businesses that are still waiting for their payments and the 709 who's, you've gone back to for further information, they've potentially gone 9 weeks without getting any payments. I mean, what do you say to them?
Well, they didn't lodge their application until a couple of weeks ago, so we can't process an application we haven't received. So I think we've been receiving applications every day through the process, and those ones have only come in the last couple of weeks.
Chief Minister, the modelling, which I hope the Health Minister can share with us soon, will show that there'll be increasing pressure on our health system. Are you going into National Cabinet arguing for more support from the Commonwealth, or has there been any support foreshadowed from the Commonwealth to help our health system?
Well, we have a cost-sharing arrangement at 50-50 for some aspects of the COVID response. Health ministers have written to the Commonwealth seeking to expand that in a couple of areas that I've sort of outlined in some detail at previous press conferences. That's included responses within the health system, Commonwealth areas of responsibility, namely aged care and the NDIS, and freeing up hospital beds from people who should be in an aged care placement or with an NDIS supported placement. So that's purely a Commonwealth responsibility. So there was one single thing they could do that didn't involve them having to spend extra money, would just be to meet their obligations to older Australians and to Australians with a disability through their aged care programs and their NDIS programs. Another element of the partnership with the Commonwealth has been around mental health, and I have seen some further announcements from the Commonwealth in that regard. We will clearly continue to focus on the needs of the public health system. Our conversation is necessarily with two other governments, though, New South Wales included, because a large number of New South Wales residents will need their acute or intensive care at Canberra Hospital.
Have you run the numbers over the cost of the pandemic so far to the health system?
To the health system?
The Minister's outlined
yes.
A very large boost to staffing
yes.
and all that kind of thing.
Yes.
I'm just wondering if you've got a number for it.
Well, it's in the hundreds of millions, and it's outlined so it's over 2 fiscal years so far, outlined in the final result for the Territory for fiscal year 2021, and what has been budgeted and provisioned for in the current fiscal year we're in, 21-22. But across the 2 fiscal years, the COVID response alone, that's above business as usual, is hundreds of millions of dollars. Now, I guess it depends in terms of the next level of detail you want about what pertains to Canberra Health Services and the hospital, as distinct from ACT Health and the public health response, and Dr. Coleman's team, the contact tracers, all of the other elements that constitute the totality of the health response. That certainly runs into the hundreds of millions of dollars, some of which is shared 50-50 with the Commonwealth. Other parts are borne entirely by the Territory. And then some we hope to reclaim some cost under our cross-border arrangements with New South Wales.
Chief Minister, most will probably welcome the change in restrictions tomorrow and more freedoms to do more things. For some, though, it may be a little anxiety-inducing. How incumbent will it be on individuals to make risk assessments about situations they go into when they go out and see far more people out and about? And what's your advice to people about that sort of a situation?
It's an excellent question. Our government research is showing, perhaps in spite of some of the noisy elements that you hear in the media, that in fact the overwhelming majority of Canberrans are approaching this with a degree of caution, not sort of exuberance or Freedom Day type rhetoric. So that's the majority view in the ACT, and so I think that has been a consistent pattern of community response. So there will be some people who will be concerned, particularly those who are the parents of unvaccinated children, and so the advice is that the things that we have been doing together successfully for some time now need to continue to be done. So washing of hands, wearing of masks, not taking unnecessary risks in terms of being in crowded environments is particularly important if you are unvaccinated or if you're only partially vaccinated. So part of the concern that we have at the moment is that the overwhelming majority of the 90,000 who are not yet fully vaccinated are under 40. Now, I'm not under 40 anymore, but I remember when I was, and certainly it wasn't that long ago, but that section of the community are the most socially active. They are the ones most likely to be in more risky situations, but they are also the generation that bridges younger kids and grandparents. And so that's why I think you've got to look beyond just headline territory-wide or state-wide vaccination statistics to look at the detail of who is yet to be fully vaccinated and what risk are they exposed to over this next period. Now, in 3 to 4 weeks, a lot more of the under 40s will be fully vaccinated, and it'll be a lot safer for everyone then. But that's why it's a gentle step forward now, why we do urge caution. But there's a lot of people who are pretty keen to get their hair cut, pretty keen to get a couple of other things done. I was watching ABC News last night, and apparently getting your nails done, in fact, outstrips getting your hair done by a long way. There you go. Always rely on Alan Kohler for an interesting fact.
Chief, any update on the New South Wales declaration of the ACT as a COVID area of concern? And have you spoken personally with the New South Wales Premier about this whole cross-border mess?
So I understand that they may be poised to make an announcement. We have had engagement at health level, at cross-border commissioner level and at political level with a number of members of the New South Wales government. And we hope that they will make a announcement in relation to the overall removal of the overall area of concern rating that they give the ACT. I also understand that Victoria may be in a position to downgrade us from red to orange in terms of risk, and so that will be welcome news to people who have connections to Victoria. New South Wales, though, still draw a distinction between Greater Sydney and their regions, and they still potentially have different settings in terms of risk within their regions, because it's a big state, New South Wales. And so I understand that they are not just looking at the headline vaccination rate for the state as a whole, because that is driven very strongly by Sydney, and they're also looking at vaccination rates in their regions. And so I understand that that will be a determining factor in the next step for them. So what I am anticipating is that in the next 24 hours there will be some good news in relation to travel, particularly within the 27 postcodes immediately surrounding the ACT, and that in a couple of weeks' time, and possibly sooner, there will be better news around more travel in regional New South Wales. And it is possible by the end of this month, or again a few days earlier, that the answer to the other two questions most commonly asked about Sydney and the South Coast will be positively resolved. So it's days or weeks away, not months away now.
Just picking up on your earlier comments about certain cohorts that are vaccinated and not vaccinated, the ACT obviously reports vaccination rates as 12 and up as opposed to 16 and up. If Pfizer is approved for 5 to 11-year-olds, will the reporting change again to be 5 and up? And would that change anything in terms of vaccine targets for reopening or anything like that? I realise it hasn't been approved yet,
okay,
but the process is underway.
Sure. I don't believe there's any likelihood of an approval in Australia and a rollout beginning before we have got through the stages of our pathway forward. We would, of course, report on that age cohort's vaccination status in terms of first and second dose, and that would then feed into a territory-wide reporting framework. But as a determinant for future decisions, really the only thing that we would be particularly focused on is if there was a very significant level of virus transmission amongst 5 to 11-year-olds, and that was feeding through into increased hospitalisation and, heaven forbid, increased serious health concerns for 5 to 11-year-olds. So in COVID, nothing is certain. I don't know what the next variant of this virus is going to be like. I do know that it is, that they are circulating around the world, and that whilst our local vaccination achievements are outstanding and Australia's vaccination achievements after a slow start are starting to be in the top half of the world's efforts, we should all be concerned that there are many other parts of the world where the vaccination rates are incredibly low, and that poses a massive risk of the virus further mutating, developing new strains, and that being potentially a cause of concern for all of us. So beyond our responsibilities to fellow Australians through our vaccination program, I believe our nation has a responsibility through the COVAX program to support other parts of the world, and we have a special responsibility in the Pacific, and a particular responsibility in Papua New Guinea. And the reports that we've been hearing out of PNG are really, really sad and really concerning. And so whilst I know everyone's focused on what's happening in Canberra and what's happening in Australia, please also let us focus on what's happening in our region and around the world, because it does matter for us in the future.
Just on the teacher vaccine mandate that came into place yesterday, or that announced to come into place later in the month, you previously said that a vaccine mandate wasn't necessary because the survey had shown very high vaccination rates among teachers. Yesterday, Dr. Coleman said her advice to the government had not changed regarding vaccines. Does this mean the advice was previously not taken, or was the advice to government changed?
No. So at the point at which that question was asked of me, the survey data showed that the vaccination rate for teachers was higher than the general population. Our approach throughout this has been to use mandates as the absolute last measure, that it is much better to get to where you want to get to in terms of high levels of vaccination through voluntary means and through education and engagement rather than the sledgehammer. Don't need to use the sledgehammer first. Then, of course, things have evolved in terms of information about how and where the virus transmits, what sort of risk profiles there are, and what other public health measures need to be put in place. So we didn't need a mandate on teachers when they were remote teaching, when kids weren't at school, and when our vaccination rate was so high. In the end, the mandate will impact dozens out of thousands. And so we've got about 6,000 teachers, support staff, cleaners, etc. within the public system. 5,920 odd were already vaccinated voluntarily. So all the mandate is focusing on is the balance. And so I think that's an important nuance in the context of how you achieve an outcome. Now, you know, there are alternate approaches. You can come in heavy-handed at the beginning, but what I care about is the outcome. And we've got 99% coverage without having to mandate. We're just covering off the last several dozen people.
So just to clarify, health advice has always been don't put a mandate in until you want to try and get those stragglers.
Yes, that's right. That's been the approach on aged care. We wanted to encourage people to get vaccinated, and then we gave people time, and it is a much more positive and human rights compliant way of achieving the outcome. Now, I know there are other approaches. I recognise that, but this is a clear difference between how the ACT has approached getting people vaccinated and how other jurisdictions have. And I would submit that at 98.9% first dose, that our approach has been much more successful.
And just also on schools, will public school students be expected to bring their own masks, or will they be supplied?
I'll take that one on notice. I'm sure schools will have some supplies, but then I imagine that many will want to bring their own mask as well.
Questions for the Health Minister?
Okay, thank you.
Hey. You spoke a little bit about some modelling that you've been undertaken as to what the health care system capacity is going to be. Can you share some of that modelling now?
Yes, so I think to be clear, what our teams have been trying to do is a couple of things. So firstly, they sought to replicate the Doherty modelling for our local area, and then they've done a bit of modelling or a bit of thinking and projections around, and it is modelling, but it's also a movable feast, based on their understanding of what we've seen overseas in other jurisdictions and also what we are in fact seeing in the ACT. And so this is really about projecting ahead for the next few weeks, and I might ask Mr Peffer to provide a little bit more detail as well. But to give you an example of how this changes from week to week, a couple of weeks ago the CEO's email to health staff said our current projections, based on our case numbers that we're seeing at the moment, we'd expect to see about 30 inpatient admissions and up to 10 people in intensive care. Then we saw that those numbers of 50 cases a day weren't being sustained, that those case numbers started to come down, and so this week's advice to staff was actually we've brought that down, that projection, to 17 to 20 ward admissions over the next few weeks and 6 to 8 people in intensive care. So it's really about saying, what are we seeing? What are we projecting based on everything we know about the effective reproductive rate in our community, the transmission potential in our community, and then the impact of the vaccination rate to give us an idea of what we're expecting to see in hospital admissions. So it's kind of difficult and not very helpful to release a point-in-time model when we're really updating that at least weekly and really reviewing it daily to do those projections.
So you wouldn't be able to provide it like what it is today?
Well, so today, the latest advice I have, and I'll get Mr. Peffer to come and have a look, is in the next few weeks that 17 to 20 ward admissions and 6 to 8 people in intensive care. Obviously, that will go up and down, and it is a projection with an element of uncertainty around it. So there's also a range of potential scenarios depending on where our case numbers head.
So it wouldn't be released weekly as it gets updated?
I'm very happy to talk about those projections weekly, and in fact I have spoken about that a couple of times previously in these press conferences. I think when the projection was 30 in wards and 10 in ICU, I did actually talk about that at a press conference previously. So we're very happy to provide those regular updates.
Minister, we understand the Chief Health Officer's gone to AHPPC and might be better placed to answer this question normally, but are you able to provide any update on the Calvary Hayden aged care facility cluster and what's happening there? Are we likely to see further serious cases and perhaps deaths come out of that facility?
So no, there haven't been any additional cases since I think the last case was reported on the 2nd of October associated with that cluster. So that is a really good outcome from that cluster. Obviously, we have seen a number of deaths, which has been really tragic. All of those people were already receiving end-of-life care at Calvary Haydon, but it is nevertheless, an awful outcome for families and friends whenever someone dies. So the only information I think that we've got an update on today is in terms of the case investigation, and I think there has been confirmation that the source of the outbreak in Calvary Hayden was a resident. So the first person who tested positive was a staff member, but we understand now that the index case was in fact a resident who had left the facility and attended a healthcare facility and then came back. No symptoms, no indication that they may be COVID positive. No one here has done anything wrong, but it's just an indication of the fact that people can be asymptomatic but still be carrying the virus and can transmit the virus. And we've seen that obviously particularly with Delta. And that's why in the case, the TTIQ, the test, trace, isolate and quarantine changes that Dr. Coleman talked about yesterday, that real emphasis will remain on high-risk settings and making sure that we're focused on any cases in high-risk settings and managing those as closely as possible, managing infection prevention and control as closely as possible, and why the new visitor restrictions for aged care facilities are mandating that only vaccinated visitors, 2 visitors per resident per day from tomorrow, but those visitors must be vaccinated. That's the only place where the Chief Health Officer has determined that vaccination is required to access a facility beyond workforce.
How long were health authorities aware that it was a resident who brought in the virus to Calvary Hayden, not a staff member?
I can't answer that. I'm afraid I don't know the answer to that.
And you just said, that resident obviously picked it up at a healthcare facility. We know that there's been outbreaks in hospitals and so forth throughout this outbreak, and we don't necessarily, or not even outbreaks, but, clusters and cases have been to hospitals and people have gone into quarantine. Not all of those have been publicly identified. Are you able to provide any indication as to how many outbreaks have taken place, or how many times the hospital or certain wards at the hospital have been deemed, close contact sites and forced people into quarantine?
Most of those have been publicly talked about because that information is provided to staff and to patients, and then we tend to talk about it publicly because we want to be really transparent about that. I do understand that Calvary is intending to make a further statement later today, so I might not say anything more about that at this point. I think they're better placed to talk specifically about Calvary Hayden than I am at this time.
Yeah. And so the public will continue to know about outbreaks that come from hospitals, even without press conferences. Like, that's information that authorities are going to share?
Look, I think it really depends on how many people are affected and what the impact of that is. As we see more and more cases, we are going to see more people with COVID at hospitals. We see people, we've talked about the fact that we've been seeing people undiagnosed cases turning up in the emergency department, that's obviously creates a potential risk of exposure. That's managed very, very closely in the emergency department. They have a red zone for anybody who's appearing who may have a risk of either having been exposed or have respiratory symptoms. And again, if you want more information about that, Mr. Peffer is here and can talk about that. But I think it will really depend on what the circumstances are as to whether we talk publicly about it. We're not intending to hide anything, but we also, there's not a lot of point in talking about the fact that we've got COVID positive people arriving at our hospitals. That's now happening almost daily.
And is there? I asked Dr. Coleman about this yesterday, but has there been identified close contacts at the Canberra Region Cancer Centre, and how are oncologists and people from that centre now in quarantine due to that?
I'm not sure if I've got those numbers again. Mr. Peffer might be able to help you with those numbers. So there was a staff member who had worked in that part of Canberra Hospital who was identified as a case, and so there was testing being undertaken, close contacts identified. I have not heard of any positive cases coming back from that, so all the tests, as far as I'm aware, have come back negative, but we'll double check that.
Minister, acknowledging significant work has been done within the health system in recent months to improve it and make sure it's ready to go for the end of this lockdown. Should your government have done more in the months and years leading up to this? Because a lot of the problems that have been highlighted, things like lack of staff, have been around for a long time.
Well, we've obviously just made the biggest investment in the healthcare system in a single budget since self-government, more than $500 million investment in our health system. And that is a recognition that we do need to do more. But what we've seen right across the country is these really high levels of demand for our health services, which haven't followed just a gentle and predictable trend, but have actually seen significant increases for emergency department presentations, emergency surgery. We've invested a lot over recent years in elective surgery, and we've done an incredible job reaching record levels of elective surgery every single year, and actually starting to bring down those elective surgery waiting lists and wait times. But we certainly recognised that there is more to do in this space. We've also committed, obviously, to nurse and midwife to patient ratios, recognising that we need to work with our nursing staff to ensure that there are enough nurses per patient and that we can be held accountable for those ratios being delivered, so that patients are kept safe, but also that staff have the opportunity to be appropriately supervised, to undertake training, and to make sure that they know what they're going to be faced with when they come to work every day in terms of those staffing ratios. So we certainly recognise that there is more to do, but we also are facing a situation, as every jurisdiction is across the country, where we're seeing that increasing demand, and that's why we're really calling on the Commonwealth to come to the table and have a conversation about the things that they can do to make a difference. One of the things that's creating pressure on our health system is long-stay patients who are unable to be discharged to a National Disability Insurance Scheme package or to residential aged care in a timely way, and that's taking up a hospital bed that could be being used by somebody else. We're seeing primary care having had a Medicare rebate freeze, in the ACT having had the bulk billing incentive removed for the ACT, despite the fact that we have the lowest rate of bulk billing in the country, despite the fact that we have the lowest proportion of GPs per head of population in the country. And so we're seeing GPs telling us that they are not able viably and sustainably to support patients who have complex and chronic health conditions. They do it, and they do an incredible job, but they are under pressure, and that is resulting in increased pressure on our hospital system. So all of these things are absolutely the case. We've been working with stakeholders through that for some period of time. And we recognise that that creates pressure on our staff as well, and that's why we've made this really significant investment in this budget, in emergency department, in elective surgery, in emergency surgery, in our culture review, which we've continued to invest in, and right across our community-based services as well, so that we can keep people well out of hospital to the greatest extent.
So you say the stresses as a result of this outbreak were unavoidable?
Well, I think it is a global pandemic. We've seen it right around the world and right across the country, that it does create pressure. But this is exactly why we've focused on very high vaccination rates, and Canberrans have been incredible coming forward, because we know that vaccination is the best thing you can do to avoid ending up in hospital and to avoid ending up in intensive care if you get COVID, and why we've invested in all of our public health response, and why we are, and $90 million we've invested in this budget in our COVID-19 response, between our public health response and our direct response to COVID-19 vaccination program, and why we've also chosen this path of a gradual easing out of lockdown, so that we can be assured that we reach that really high vaccination level, we understand what the impact is on our hospital system, so that we don't see the kinds of pressures that they've seen in Sydney, that they've seen in Melbourne, and that, of course, countries around the world have seen on their hospital systems.
The modelling figures, what do they tell us about the number of cases the health system's expecting over the next few weeks?
So I might actually get Mr Pepper to talk a bit more about the modelling, if that's okay, if there are no more questions for me. Okay, thank you.
Good afternoon. Sorry, what was the question?
Yeah, g'day. It was about the modelling. The Minister said on today's figures it would be hospital admissions 17 to 20 and 6 to 8 in ICU. But what were the case numbers? What are the case numbers you're expecting over the next few weeks as well?
I guess the challenge with any modelling, particularly here in the Territory, is you're dealing with quite small numbers, and so it does have a tendency to move around quite a bit, which we've seen since the beginning of this current outbreak, and we've been doing some of that work. So there's two tools that we use. One is sort of a longer-term projection, and one is a shorter-term prediction about the actual beds we'll need in the system, and we use that to bring online capacity. In terms of the weeks ahead, the model is projecting a very gradual rise in case numbers, not a huge step up in the weeks ahead. But again, working on small numbers, you do get a variability in what can happen week to week. And I guess if we think about it, I think about it a little bit like reading a book. When it's right in front of you, it's quite clear, but when it's metres away, you're really guessing what's on the page. And so for us, as we project forward months into the future, the confidence interval is very broad and can give you a range of scenarios, but in the weeks ahead we can be reasonably certain about what we're looking at.
All right, well, at the moment we're about 40 to 50 cases a day. Are you looking at up to 100 cases?
I think what the model's currently projecting is increases in the tens, not the hundreds.
In the tens, okay. And the reduction in the modelling from, say, 30 admissions down to 17 to 20, is that due to our vaccination rates improving?
Yeah, so there's a combination of a few things that are moving around there. One is certainly the vaccination rate, and as we see that start to increase, or as we've been observing it increasing very quickly, that does have implications. And I do have some numbers in front of me which has been used to guide the modelling. So at this point in time, 6% of hospital admissions have been fully vaccinated. In terms of ICU admissions, so these are our sickest patients with a severe case of the disease, 24 have been admitted to ICU, not one of them has been fully vaccinated. And this is what we're seeing around the country and around the world in terms of the impact of a highly vaccinated population.
So are you expecting a steady gradual rise, a plateau and then a decline? Is that the
Yeah, I mean, look, that's the standard epicurve that I think just about every model is projecting in the weeks and the months ahead. And I guess as the Minister, as the Chief Minister and the Chief Health Officer have all said, this is the first time that Canberra will go through this. And there's a few things working in our favour, very, very high vaccination rates, but also that we're doing this in summer. And if you look at countries around the world, not all of them have been in that position where they're heading into a summer expecting that acceleration in cases. So that will certainly work in our favour.
But going forward, you'll be looking more at hospitalisations as the key number to look at.
Certainly within the health system, that's our primary focus.
So just on that, with cases and reopening, and are you expecting more staff having to go into quarantine across Canberra Health Services? And how many are in quarantine at the moment, both overall and as a result of that oncology Canberra Region Centre, Cancer Centre exposure?
Yeah, so what we've seen since the beginning of the outbreak is continued examples where our team members have been at exposure sites. And I have to say the vast majority of them have not been in the hospital. That's out in the community or household contacts. And so we do expect that will continue into the future. And I have to say, in terms of the pressures that we're seeing in the system, as the Minister has said, there's been no change. We saw demand snap back very quickly, a bit like a rubber band. The experience last year was it took some months for demand to get back to where it was. This time around it's been much more rapid. Having said that, what is particularly stretching the workforce and stretching the system is when we do have exposures in our hospitals. We do expect that will continue. I think that's a way of life now for the weeks and months ahead. At this point in time, I think there are 13 team members who've been affected by the Cancer Centre exposure, and I believe there's 56 team members all up that we currently have out of the workforce in quarantine.
Just a question for the acting CPO, if that's okay.
Thank you.
When does the ADF finish up, and can you tell me what the COVID operation will look like moving forward, what duties police will be returning to?
Yeah. Our role with the ADF in terms of the compliance for traffic compliance will pretty much finish today. But as to be expected, as we start to open up and the restrictions are reduced and people start to do the things they would normally do, including socialising and going to different locations, and as we said, it's a limited opening up today. The restrictions are reduced, but our policing members will move back into a more traditional way that you'll see the things they're doing. But importantly, we're not reducing our focus on compliance. That will remain, as it always has, and you'll see that every police officer is focused on compliance. It's just that some of that specific stuff will reduce.
Do you have any concerns about the border effort finishing if there are still these rules restricting who can come in?
No, because again, we're taking an anywhere, anytime approach, which we have throughout the process. It's more challenging as it's reduced to be able to understand, exactly what people are coming and going. But the requirements for a person to be able to come into the ACT have not changed. There's still those restrictions, and people need to be firstly aware of those, and if they need to ensure they've got their exceptions to be able to do that before they enter.